Your first and last name?
Dwayne Adams, March 10th, 1990.
Do you have any drug allergies?
Not that I know of.
All right. And how old are you?
I am approximately 30 years old.
Nice to meet you.
Nice to meet you.
I'm Kaya, and I'll be your nurse today.
Okay.
I'm just going to be doing a focus assessment where I'll assess your abdomen. We'll do some coordination drills, and I'll be assessing the reflexes. Is that okay? All right, so now I'm just going to take a look at your abdomen and expose your shirt out. Okay, have you went ahead and emptied your bladder?
Yes.
Okay. So right now I'm just going to take a look at your abdomen. I'm going to notice any masses, any hernias, peristalsis, surgical scars, or any striae. I'm also going to notice the contour. You can see your abdomen is rounded but not distended. The color is uniform and appropriate for your ethnicity. As I look around your umbilicus, there's not any bluish tint, which would indicate colon sign. As I assess your flanks, I don't see any discoloration as well, which would indicate Graves' Turner sign. Don't notice any striae. There is hair that is generally dispersed but uniform. There's no visible movement, any lesions, visible masses, or hernias. I'm going to go ahead and take a listen. I'm going to start in your right lower quadrant. I'm going to move up in a clockwise fashion. All right, your vowel sounds are present and noted throughout. I'm going to listen for any bruise. All right, now I'm going to auscultate the arteries. I'm going to start at the aortic, right renal, left renal, right iliac, left iliac, left femoral, and right femoral. Okay. So I don't hear any extravascular sounds, any bruise. I'm going to check your femoral pulses. Okay. She plus a normal. I'm going to move on to percussion. Right lower quadrant. Okay. Alright, tympani heard throughout. I'm going to do some light palpation. I'm going to go a centimeter deep. I'm going to do 3 areas in each quadrant. Having any pain? Alright. Now I'm going to move on to deeper palpation. I'm going to palpate at least 5 to 8 centimeters, so there'll be a little more firm pressure. Okay. So far I haven't felt any masses. There's not been any muscle guarding, no rigidity, no tenderness. Still doing okay? I check for any bladder distension. Alright, I'm going to check the size of your liver. Make sure there's no enlargement. Alright, so his liver is about 10.5, 11 cms. I'm going to find the 12th rib, 11th, and the 10th. And I'm going to palpate the spleen. Any pain? Okay, can you take a deep breath? Can you hold your stomach in? Like, inhale. Blow the air out. Okay. So no organomegaly in either the spleen or the liver. I'm going to assess the kidneys. Any pain? Okay. All right. So as I inspected the abdomen, there weren't any bruise, hernias, masses. Tympany was heard throughout. There was a little dullness over the liver. That's as to be expected. His liver wasn't tender, or there was no bladder distension or splenic enlargement. Now I'm going to assess your coordination and proprioception. Can you walk forward for me? All right, can you walk backwards? Can you stand on one foot? All right, the other foot. All right, can you walk like you're walking on a tightrope? All right, and then can you go back? All right, you can stop right there. Now I'm going to do a Romberg test. If you could stand with your feet together, your arms at your side, and then close your eyes. Okay, I'm going to assess you for 20 seconds. Okay, good job.
Jump.
Right, and lastly, can you walk on your tiptoes? Good. All right, so now I'm going to assess your bilateral coordination. I'm going to hold my finger out, and then if you can touch my finger, then touch your nose. Again. Yeah, now your left hand. Okay. Can you touch your index finger to your thumb, to your middle finger? Okay. Can you increase speed? Can you go opposite direction? All right. Can I see you get on your left hand? All right. Can you, okay, hold your hands over your knees. Okay, so pronation is down. And then supination is if you hold your hands up like you're holding soup in your hands. Okay, so we're going to do pronation, supination, continue. Okay, can you increase speed? All right, go down for this, but you're going to take the heel of your right foot and touch the knee of your left leg and rub your foot down your shin.
Can I use my hands?
No.
Or just, I do like this?
Yes, and go like that.
It's intense.
Perfect. All right, and the other leg. All right, perfect. All right, so now I'm going to test your sensations. I'm going to test them on your upper extremities first, and then we're going to move down to your lower extremities. All right, can you go ahead and put the eye cover on? Okay. So you're just going to tell me what this, if you can feel the sensation, and what it might be.
Feels like some kind of feather on my face.
Okay.
Something, either fur or a feather.
Fur or a feather. Okay. So tell me if this is, what sensation this gives you.
Like a finger pressing my shoulder. Something sharper.
Okay, so sharp sensation.
Yeah.
Okay.
Something pointy. Something a little bit duller.
Can you hold up your hand? And you're going to tell me, where do you feel this sensation?
In the center of my hand and my palm.
Okay.
On the base of this finger. Right here.
Okay. I'm going to perform a graphesthesia assessment. And you can just tell me what object I'm writing in your hand.
So like the number 2.
Okay.
Number 4.
Okay.
Is it number 8?
Correct. All right, now I'm going to perform a stereognosis assessment. I'm going to place some objects in your hand, and you can tell me what you think they might be. All right?
That is the key to my heart.
Okay.
That is a paperclip.
Okay.
Thing of dental floss.
Correct. All right, so now I'm going to perform the positions test. I'm going to position your finger in a direction, and you can tell me which direction that might be. Okay?
Up, down. Down, down. Up, up. Up, down.
Okay. So now I'm going to perform the 2-point discrimination test. I'm going to put a object on your hand and you can tell me where you feel.
Right here, right here.
Okay.
Right here and right here.
Correct. I'll be performing the vibratory sensation test. You can tell me when you feel a vibration and when it stops.
Now. Stop.
Okay.
Now. Stop. Now. Stop.
Correct. I'm gonna test the sensations in your lower extremities.
Maybe something soft.
Okay.
Or something that's soft. Something sharper.
Okay, so now we're going to do the 2-point discrimination test. You can tell me where you feel the sensation.
Right here. Right here. Ooh, right here.
Okay. All right, so now we're going to do the vibratory sensation test. You're going to tell me when you feel the vibration and when it stops.
Start. Stop. Start. Stop. Start. Stop.
Okay. Now I'm going to test the reflexes in your lower extremities. So if you can just relax your legs, I'll use the reflex hammer and it'll be a slight tap. Okay. Okay. I'm going to touch your Achilles. Okay. Okay. I'm going to test the Babinski's reflex. Okay. Okay. All right, so now I'm going to test your upper extremity reflexes. First, I'm going to test your brachioradialis. Okay. I'm going to test your biceps. Can you flex for me? Okay. Relax. Okay. Flex your arm. Okay, relax. Okay. All right, I'm going to lastly test your triceps. Let's see. Your arm's a little big. Okay, if you can just relax. Okay. Relax. All right, perfect. All right. All right, and that concludes the assessment. Do you have any questions or you have any discomfort?
Not at all.
All right. Thank you. to let me perform the assessment on you. Right, and if he was in a bed, I would make sure his bed was in lowest position and the wheels are locked and his call bell was in reach.